MSD for Mothers has been a strong advocate for improving maternal health outcomes, especially across West Africa. Now, how can partnerships between the private sector and creative platforms like this gala drive sustainable change for women's health in Nigeria?
I think the critical thing and the word that I want to pick out of the question that you've asked me is partnerships. Women's health, maternal health is everyone's business. Private sector, public sector, the creatives, the NGOs, the business people, the innovators. The whole point of hosting this sort of event, firstly, is to create awareness. There are many people who didn't know that Nigeria was one of the riskiest places to have a baby. There are many people who do not know that postpartum hemorrhage is the #1 killer of pregnant women, and that there's a lot that can be done to prevent it. There are a lot of women who do not know that attending antenatal classes is very important in ensuring that you have good outcomes. It's not just happy clappy time to sing and kill time with healthcare workers. It's time when you're examined, you're prepped, and you can determine whether a woman would need an assisted delivery through engagement in antenatal. So these are things we need to talk about. These are things that people need to be aware of. People need to understand what the challenges are so that if they are able to bring their creative genius to the table to address it, they can. Also, it helps to create a society where everyone is invested in maternal health. Everyone is invested in women's health. Like I said earlier, women's health is critical for two reasons. The first reason is because women contribute significantly in terms of economics to the GDP of the whole world. This is not just in Nigeria, but in Nigeria and globally. There's a study that has estimated the opportunity of closing the health gap between women and men to be up to $1 trillion globally. So women count, women improve the economic outcomes of a nation. The second reason is because a woman plays a very critical role in the family as the custodian of the health of every family member. So it's in the interest of the family for the woman to thrive, because if she thrives, then her children thrive, her husband thrives, her family is well fed. It is women who look after the aged parents in the household. And so if you want a healthier country, then you need to partner with women. You first need the women to be healthy, and then you can leverage her health as a pathway to ensuring the health of family members. And so I think that this sort of event brings stakeholders around the table, public, private, NGO, creatives, innovatives, everybody, anybody, to understand first the issues around health, where the inequities lie, and the opportunities to bridge this gap.